Hi, my name is Brendan Hahn, and this is my night presentation on cerebral palsy. So, why did I choose cerebral palsy? What about the topic stood out to me? Well, the truth is I chose cerebral palsy due to my own ignorance on the subject. I have actually spent the past 12 years or so in military medicine learning about all sorts of genetic and illnesses and all sorts of disorders. However, when it came to cerebral palsy, I had actually thought that it was a genetic disorder. Turns out it's not. Well, if cerebral palsy is not a genetic disorder, then what causes it? Well, a couple things can cause it. A lack of oxygen to the brain, or various different kinds of infections, or even bleeding to the brain, but most commonly, trauma to the head. So, what does cerebral palsy look like? Well, it occurs in about 3 out of every 1,000 children being born. Some of the predispositioning factors include, prematurity, blood clot, a weak immune system, substance abuse during pregnancy, and most notably, again, trauma. So, what does a patient with cerebral palsy look like? Well, the truth is they look just like you and me. They just have different symptoms. Some of these symptoms can include spastic movements of the arms and legs, involuntary control of different types of movements. They also have various other symptoms, such as more serious health issues like a predispositioning factor to seizures, hearing loss, learning disabilities, and most notably, bone abnormalities. So, how does all of this apply to early childhood education? What does your typical classroom look like on a day-to-day basis? You might have anywhere between 5 to 15 children with just you or maybe one other person in the classroom. Do we really ever stop to think about, what would our classroom look like if we had a child in there with cerebral palsy? Which brings us to really an ethical question. Do we have a moral obligation to provide for these students, to provide care for them? Well, according to the NAEYC and their Code of Ethical Conduct, we know a couple things. One is that we should appreciate childhood as a unique and valuable stage of human life. 2, we need to respect diversity in our children, our families, and our colleagues. So we know we have an ethical responsibility to care for these children. However, why is it that when you do a Google search for it, you find tone-deaf message boards talking about how teachers have turned them away due to capacity issues? Well, part of the reason is because of the ADA. The ADA can be expensive, and it's hard to retrofit any current facility to fit the standards and specifications that would allow for a child to move freely about the facility. So what this really comes down to is it a legal issue? And the answer is yes, it is a legal issue, and the federal courts have ruled saying that in Title III, the only exemptions belong to religious facilities such as churches and mosques. So now that we've spoken a little bit about what it should physically look like in the classroom, what does teaching look like? What does curriculum look like? But let's get real with it, is that we have a hard enough time as it stands getting our staff to show up on time to work on a day-to-day basis. In fact, a recent report from the Bureau of Labor and Statistics showed that there's approximately 25% turnover annually in the field of early childhood education. So how can we help children with cerebral palsy live better lives? The answer is pretty easily. In the field of early childhood education, when it comes to cerebral palsy, one of the toughest issues that we face is self-image. How do we help those with cerebral palsy feel a sense of normality among their peers? The answer is simply inclusion. Take your scholars out to recess. Don't exclude them from any activity any other children in the class are doing. This can include arts and crafts, or it can be something as small as going to the restroom. This comes down to adapting and rethinking the classroom. One of the hardest parts about being a caretaker is putting ourselves in the shoes of those who we're taking care for. So how do we as teachers and administrators limit the distractions in the classroom and make it more conducive to learning for those scholars? Lastly, we need to be more conducive with our communication with those scholars. How do we incorporate communication with that scholar on a day-to-day basis? Without communication, we are essentially isolated. This in return to be consider ourselves to be different. We want to make the environment inclusive in all aspects, and the easiest way to do that is by including them in all communication that happens in the classroom. Scholars with cerebral palsy or any disability are our responsibility as caretakers. If there's one takeaway that I can impart upon you from this, is that please don't discriminate with experiences. I challenge you to go back to your daycare or learning center and take a look at your classroom. Consider how can you make this room something more than it was yesterday for all of your scholars.